Please welcome Dr. Sam Battaglia.
Dr. Sam, would love to hear your story, how you got introduced to ARPneuro and how long ago was it?
Well, I started in practice in 2001. I had chronic tendonitis in my shoulder biceps tendon, and working with team chiropractors and team PTs, working on that area, it would get better, but it just kept coming back. It would never go away. Going through the therapy, one of the reps, they determined that posterior delt and infraspinatus weren't firing properly. It's not something you can see in an MRI. It's not a test you can take to find that out. They just don't fire at the right velocity and time because of repetitive dislocations. So everything I did in the front of my body with hockey or working out loaded up the front of the shoulder. And that's what kept giving me that tendonitis. Once we introduced the RX100 through a scan, diagnosed that the posterior delt and the infraspinatus don't fire, turn those muscle groups back on again, puts my shoulder back in neutral, and then the biceps tendonitis goes away without ever even treating it. Once I saw that, then I said, we need this machine in here. Because as chiropractors, we're all doing the same thing. We all went to the same schools, and this is something that would set me apart from everybody else. And that's what's happened. So I have people that travel from all over, even out of state, Indiana, Southern Illinois, Wisconsin, that come for this therapy because it's not readily available.
Tell us a little bit about how you've had so many patients and so much success with the ARPneuro treatment.
Our first location is in downtown Chicago. Just a year and a half ago, we moved into a second location in the suburbs. We've tried the marketing in the past 20 years ago. Nothing really works. It's all word of mouth. If you're not going to a dentist or a chiropractor based out of the yellow pages or online, you're going out of a referral. At this new location now, it's predominantly what I do. I do 90% active therapies with the RX, and I can't stop running. I've got patients that are coming in all day long. I'm probably going to hit my PR record again this evening. It's just football players, basketball players, the hockey players are all coming in because they're trying to get that advantage, something that they've heard about or they've been other places and they've kind of plateaued, and they've heard about what we can do about the speed of recovery, the speed of strengthening, the way that we can scan the body and find out where we need to be as opposed to just guessing.
You mentioned, Dr. Sam, about set a new PR. What is going to be your new PR record?
2 weeks ago, I hit 180 patients in a week, so I should beat that this week. I can have 4 to 6 people going at the same time. I can just bounce in and out of the rooms. You know, I've got one person doing anterior delt raises, the next person doing lunges, and the third room doing Supermans, and I can just manage them all at the same time, running in and out, making sure everyone's got good form, turning up the machines, doing 4 to 5 sets, and then having a little pocket area where I can have people running in foot baths for neuropathy and plantar fasciitis that aren't moving.
Wow.
Oh my goodness, that's crazy.
And what's the first success story that comes to mind?
A really good one is a young kid. He's in high school. He's a lacrosse football player. During a lacrosse game, he had a complete tear in his ankle. He went to his first orthopedic. They said he needed surgery without ever coming here. His dad had been a patient of mine. He came in. I took a look at him. In a couple visits, we had him doing a lot of movements, lunges, Bosu balls. And I said, you should probably get a second opinion. He gets a second opinion. The second ortho said, I would not touch that with a 10-foot pole. Just keep doing what you're doing. Because of the videos that he showed him in terms of the injury, then the videos on his first visit that his dad took, and then 3 or 4 visits later, what he was able to do over a short amount of time. And looking at his MRI, he suggested that to do as much as you can without the surgery. I think this week was his second full week of football, no problems.
And why is this not prevalent with other chiropractors around the country? And what's the holdup, do you think?
One of the stories I could share is I had a baseball player. He had pitching pain in his scapular area. Dad's an ortho, working with him in PT, wasn't getting better. She started doing some research and she Googled me and found me. Got working with him. Scapular pain was going away within a few visits with pitching because he wouldn't stop. And then the mom said to me after a visit, she's like, I'm not telling anybody about you. You're my own little secret. So there is an advantage, I think, with the therapy, especially as you get older in college and pro, that I don't think people want that out there. They want to keep it for themselves.
You definitely see that in the professional ranks. And as we started adding some of those stories of pro athletes utilizing the technology after their career's over, they seem a little more vocal on what they did.
And they don't want injuries to be known. And they're using a machine at home or at one of their trainers or in an office like this. They don't want to lose their spot. They don't want the other team to know that they're hurt. And there is an advantage to something that you could be doing at home to speed up recovery, speed up healing. At the end of the day, moving into strength training with it.
Now, what are some of the top 5 injuries that you treat with the ARPneuro technology?
Anything that walks in my office that's an extremity, shoulder, knee, hip, ankle, wrist, elbow, they're going on this machine right away. With this therapy and the protocol, there's nothing like it. Traditional chiropractic can't touch it, in my opinion. If somebody's going to come in with lower back pain, you can kind of go either way. If somebody's used to chiropractic visit where everything's passive heat, that type of thing, I can do that too. But what ends up happening is they plateau. Then I move them into the ARP wave and its protocols. My favorite joint is the shoulder because I've had the injuries. Somebody walks in here not knowing what we do and what ARP is, and they have a shoulder, elbow, knee, they're on the ARP right away.
How many sessions does it take to get a typical patient out of pain for a patient to kind of start getting that mobility back and to be at full recovery?
We kind of use like an approximate 20 visit mark. Not everybody's inside of that. Sometimes you take more, depends on the injury, depends on if there's tears, more involved, but it's about 20. We use 10 to get you out of pain, 10 to prevent it from coming back through strengthening. But within the first visit can typically show somebody a 50% reduction in pain and a 50% improvement on your range of motion just in one visit. Now that won't last, and it can, but that's why you need subsequent visits. We do scans, we do strengthening, we do ranges of motion to work on all that. But on a first visit, there's a wow factor. I'll get you most likely, 90% of the time, a 50% improvement on your range of motion and a 50% improvement on your pain.
How do you incorporate the PRS? Do you send patients home with that?
Well, I always explain it to on the first visit. We have a portable unit that can complement what we're doing at home. That machine assists on what I'm doing. So I can have that patient hit those two muscle groups into our next visit. And then part two with our portable unit is that suspend, right? That background setting for blood flow. So having that machine above and below the tendonitis or front and back of the shoulder, so that there's current going through that shoulder joint to help speed up healing and recovery because you've got blood coming to the area for the next 6 to 8 hours while you sleep. And we shut those contractions off so it doesn't disrupt your sleep pattern. Wrap the cords around the unit, put it in your pockets. You can roll around in bed. Now you're talking if this patient's coming in 3 times a week, 30 minutes, that's 90 minutes in a week. You put a machine in their hands, you could be getting up to 18 hours a day of stimulus on the shoulder between blood flow and contractions. In patient education about the unit, this doesn't take over from what I do. I do a scan on you today. We identify weaknesses. We can then use the unit down the road to work on other body parts. They'll understand that the machine's not going to take over. It just supplements what we're doing.
If you already know you're going into surgery, why would anybody even use the PRS or the RX?
They want to go into surgery strong. It makes your recovery better. 10 out of 10 is a strong, normal knee. You want to go into the surgery as 6 or 7. And you do that through strengthening up all the muscles around the knee joint so that when you come out of surgery, you're already ahead of the game. And then now you have the portable unit to then apply around the dressing, getting, trying to prevent things like atrophy. When you don't use something, you lose it.
You mentioned turf toe. Could you explain what that really means? How you can help overcome that with the ARPneuro?
Basically from running, soccer players, football players, unsupportive shoes, and then the ligament on the bottom of the first toe gets stretched out and can go as far as tearing it. I'm putting a black pad on the patient's leg and a red pad on my forearm, and I'm using ultrasound gel or water to work on that toe. Same thing we can do with a finger. An area that is hard to address as far as like treatment goes, at trying to stay off of it or splint it, we can apply current to it to help speed up the healing through blood flow, strengthen of the muscle groups around to take pressure off of where the site of the pain is.
Do you recommend the foot bath for that, or is it more of a hands-on approach that you take?
I would do both. The foot bath I'll use with ankle sprains, plantar fasciitis, the turf toe, neuropathy. It might be a hybrid. A lot of times when these patients come in with the ankle sprains and their foot is swollen, they're on crutches, they're on a splint, I'll do the active movements, get them moving dorsiflexion, plantar flexion while they're seated, non-weight bearing, semi-weight bearing, and then I'll transfer them over to foot bath right after.
You also use this for other complicated issues, one of them being sinusitis.
I like to preface it and say these are rare conditions. I'm not an expert, but they are things that people will mention during a visit about themselves, a friend, or a family member. And it's something that we can show how versatile this therapy can be. You can treat things like sinusitis, trigeminal neuralgia, and Bell's palsy. And one of the things that we do is more of a manual digital type thing. What we do is we put a black pad on the base of the patient's neck while they're laying flat on their back. We put a bolster underneath the neck so it keeps that pad nice and tight. And then I put a red pad on my forearm, and we use ultrasound gel on the face. And in doing that, sinusitis is viral and bacterial, and really the only treatment for it is medications and maybe decongestants or trying to work on it on your own through over-the-counter remedies. I'm certified in acupuncture, and so I would use acupuncture on the sinus points to try and relieve sinusitis and trying to open up those sinuses. Working with the machines and other digital stuff we've done with toes and fingers, we started working on the face. You can hit those same sinus points with current through your digital finger. It's way more effective. If you think about an imaginary line going from the base of the neck to your finger, you're going through each of the points on the face, and that type of reaction opens up the sinuses much better than acupuncture. We can do between 10 and 20 minute treatments, both sides of the face. It's instant. People stand up and they start to drain or have more range of motion with their breathing, less congested, less facial pain. It's very effective.
So you're you're essentially transferring current from you to the patient. So you're actually accepting some of that current first.
Correct. It's going through the base of the neck and the patient through to my finger.
Wow. What's the intensity, the output power levels of that?
It's really to tolerance. So we start really low. There are certain parts of the face that are really sensitive, like the forehead. And so, we hit these sinus points starting in the lows, probably like a 2 or 3 output power. And then as you progress and move through it, just like you do with the other therapies in the protocols, right? You're turning the machine up to where they can tolerate it. They get used to it. It's like doing like 4 or 5 sets of an anterior delt raise with the RX100, right? You turn it up after a minute or two.
Wow. This one's fascinating. Is this also something that you can use for the PRS?
Yep, it could do the same thing. It's half the power, half the speed. But yeah, you can definitely have pads on the face over the sinuses that, again, to complement what we're doing in the office to speed this process up. And you talk about like, well, when they go away, well, no, they're going to refer more people because we can get people better, quicker, faster.
One more question on the trigeminal neuralgia. So is that a completely different modality that you're using, or you're essentially doing the same thing with
all 3 conditions are the same exact thing, especially with the Bell's palsy. There's facial drooping, right? So if you can tighten up the muscles, increase muscle tone, otherwise you're told to just wait and see. It'll go away on its own. Very effective. It's just like atrophy anywhere else in your body.
It's amazing. I still look at this and go, it's an art. This ARPneuro RX, and I applaud you for taking this unbelievable technology and being able to apply it in all these different conditions without, the traditional medicines and the pharmaceuticals and all the other things. Love to get your take on how it's changed maybe your perception of your practice.
Since I've incorporated this therapy, everything's moved into active-based therapy. I've gotten away from the passive stuff we kind of learn in school. You're talking over 20 years ago. I can scan an area, find out where we've got atrophy or scar tissue or muscle groups that are hypertonic, hypotonic. I can turn on muscle groups quicker than you can ever get on your own. Even if I sent them home with home exercises, they're not going to do it. And then the versatility of moving into things like the face or turf toe, these little areas where you can do a manual therapy with the current going through my fingers. We have the access to foot and hand baths for neuropathy. These are all things that I wasn't able to technically treat with traditional chiropractic.